Flacco and colleagues present important new data on considering ways we might categorize groups of patients with alcohol use disorders. This new study conducts what is often called a deep phenotyping approach. It examines a group of individuals with alcohol use disorders, and it characterizes them in a wide range of symptomatic features. And the study suggests that there might be meaningful subtypes of patients with alcohol use disorders based on the clinical features of those patients. Patients, for example, might cluster into one group that has particularly notable problems with executive functions. Moreover, other groups of patients might be characterized based on their emotional symptoms, either related to mood and anxiety problems or related to incentive salience. And these types of deep phenotyping studies provide important clues for our readers when they're thinking about what are the best ways to understand other variables like measures from brain imaging and genetics. These measures might relate less strongly to overall risk for substance use disorders than they relate to the types of parameters examined in this important new study. For many years, there have been questions about the long-term efficacy of psychostimulant medications for the diagnosis of attention deficit hyperactivity disorder, ADHD. And these questions have persisted because it is particularly difficult to answer them definitively in the context of a randomized controlled trial. Matt Higson and colleagues report new data from a particularly creative long-term efficacy trial that answers the question about the long-term durability of stimulant treatment for ADHD. The findings suggest that many children and adolescents will continue to benefit from stimulant medication over as long as a 2-year period. Clearly, there are individual differences in the magnitude of these benefits. For example, children are likely to benefit more than older individuals, and the effect is not as large as we might otherwise have thought. On the other hand, for the clinician who's asking themselves, how long should stimulant treatment continue, these new data provide important justifications for continuing such medicines when there are benefits over at least a 2-year period.